Welcome to the FMP Essentials Show. I am Dr. Yousef Elyaman, your host, and I am thrilled to have you here with us. Whether you're a seasoned functional medicine practitioner or just starting out on your journey, this show is going to be a go-to resource for mastering functional medicine and making a real impact in your practice and community. Thank you for joining us on the FMP Essentials Show.
Disclaimer: the content of this podcast is for educational and entertainment purposes only and is not medical advice. Always consult a licensed healthcare provider before making changes to your health regimen. Views expressed by guests are their own and do not reflect those of the host or producers. No statements about supplements or products are evaluated by the FDA and are not intended to diagnose, treat, or prevent any disease. Listening does not establish a doctor-patient relationship. By continuing, you acknowledge and accept this disclaimer.
Now sit back, relax, and enjoy the show. Hello, everybody. Welcome to the FMP Essentials Show. We have such an exciting interview for you today. Dr. Josh, give me your 76-second bio.
So 2 degrees from Harvard, 2 degrees in biochemistry, focused on reversing Alzheimer's because when I was a teenager, my grandmother got Alzheimer's and I was a biochemistry nerd. And then also a dozen years ago, I was 50 pounds overweight, had high blood pressure, and I couldn't fix it despite having all these tools from Harvard Med School and my other training. And that's when I started looking at a more functional, integrative approach, fix myself. And then I'm like, you know what? If I'm going to fix myself, why don't I share this with everyone else? And that's how I found this amazing world.
Dude, and I think the biochemistry got you really set for functional medicine because we're all about biochemistry is a big thing we do. Now, you had two choices. You could have got a third degree at Harvard, or you could have got right. What made you what made you ended up joining? How did you certify in functional medicine or integrative personalized medicine?
Oh, it's interesting. You know, the audience may not like this, but this was many years ago. Back then, there was actually a waiting list to get to functional medicine conferences. And I was like, I'm not waiting a year. I need to learn this now. So what I did is exactly right. With my 2 degrees in biochemistry, I did the studies myself, and I ended up working for a functional doctor near Tampa, Florida, in Oldsmar. And with my 2 degrees in biochemistry, even though they were 30 years prior, the biochemistry hadn't changed that much. So to be honest with you, I'm not board certified in functional medicine or integrative. I just was a good study. And so kudos to you for getting all those certifications. I'm in some ways jealous, but I also like the fact that I can now give back and help others. Now that there's more established programs. I know you were in the first class of was it functional medicine or
the Institute for Functional Medicine? I also did the A4M training as well. You and I both spoke there recently, so we both were speakers at the event.
Totally. And to be clear though, I got board certified in lifestyle medicine in addition to emergency medicine. And so that was my compromise. I'll do lifestyle medicine but I'm a huge fan of functional and integrative and definitely all of that.
That's awesome. We're excited to dig in here with you. So tell me about Alzheimer's disease. Why is it that you chose this topic?
Yeah, so again, it's as a teenager seeing the huge impact it had, not just on my grandmother Eileen, who got Alzheimer's, but also on my parents and their generation, because they're like, wait, if Grandma Eileen can get Alzheimer's now, what's going to happen to us in 20, 30 years? So as a teenager, I saw this and I was like, you know what? I'm going to study really hard. I love this biochemistry. And, it took many decades for it to come to fruition, but it's so cool that we now have better tests and actually treatments as opposed to, when my grandmother got it, many decades ago, there really wasn't a lot to offer.
Yeah, so and that's interesting because if you talk to conventional medicine docs or other practitioners, they'll pretty much tell you there's not really much you can do for Alzheimer's. What made you think that there was more that you could do for Alzheimer's?
Well, and here's the interesting thing. It was actually working in a clinic. It was called Spinaga Wellness Institute near Tampa, Florida. I was there for 7 years, reversing dementia from Alzheimer's and from Lyme and mold and other conditions. So the reason I was convinced that it's doable because I was actually doing it.
Mm.
This wasn't theoretical, and and that's what I love about this whole field. It's like, let's not wait until we have established science. Let's actually go out and offer the best we can to people, to patients, especially when there's very little downside, right? I mean, if you're losing your brain, if we try these different treatments and they don't work, what's the downside? I mean,
Right.
the quality of life is not very good to begin with.
Yeah, absolutely. And I think that's the thing. I think if we're dealing with a medication that has very nasty potential side effects, potentially very nasty side effects, then experimenting with or trying meds out that can potentially hurt you. But a lot of the things that we're offering people from a integrative functional medicine point of view are just like maybe things that you would find in food or changing your food or lifestyle and that can have such a huge impact. We just finished another one of the kind of deeper dives that we do with FMP Essentials is how do you deal with advanced lipid testing? And last week we just kind of did another recording. It was either last week or the week. They're all merging together. But
Sure.
one of the big things we talked about is that statin medication, the statin, the cholesterol drugs, about 70% of heart attacks and strokes happen in people that are already on them. So there's more than just putting people on medication. The lifestyle stuff is extremely important. So let me ask you. So then you end up you have this the double biochemistry degrees,
Correct.
and you start working. You happen like the kind of destiny. You end up working at this place that is using that biochemistry in real life. So that must have been exciting for you.
It was, and it's interesting because Dr. Spinago interviewed a bunch of people before he found me, and no one else could keep up with him because none of the other physicians actually had the biochemical knowledge. You know, how much biochemistry do you get in medical school? You get a little bit, but by the time you get out to clinical practice, most people have forgotten. And so I was able, of course, I was skeptical initially when, he's saying, oh, we can fix the brain by doing this, this, and this. But then I actually looked at the testing and I looked at the treatment. I'm like, wow, this actually makes sense when I put it all together.
Right. And a lot of the stuff we're doing, if you dig deep, you'll see in conventional medicine, a lot of it is buried there. It's just that the focus seems to be on the medication. But whereas, yeah, I mean, I have a local neurologist in town, and a lot of the lifestyle stuff we do, he tells all of his patients that are having memory issues. And he's not like integrative functional. He's just a neurologist that does a lot of research and studies.
That's awesome.
So let's, if somebody, we're talking particularly about Alzheimer's, and we're not claiming, hey, we have the cure for Alzheimer's, but what we are claiming is that there's different imbalances that can lead to disease, and it makes it's kind of common sense. If you see an imbalance, work on tackling that imbalance. Makes that, like, is that pretty much your philosophy?
Totally. Yeah, it's right on. And again, not to be afraid to do the research. I mean, I'm out there, I'm up till midnight, scouring the journals, looking because a lot of this is actually buried in the journals and the literature. And sure, you can go to textbooks, but what I find some of the most important information is not in the textbooks. Historically, it's been suppressed in ChatGPT and Google searches. You really have to dig deep and actually understand what you're looking for. And that's the classic scenario where someone's like, well, I don't need a doctor to figure this out. I can just do my Google or ChatGPT search. But it's only as good as the information that's in there. And
Yeah.
what's amazing is a lot of what I've learned at these clinics and doing functional medicine and doing lifestyle medicine isn't in any textbook or in any online course yet.
Yeah, I think that's a great point. And now that you mentioned people kind of so ChatGPT is the newest thing, but people would Google stuff and bring it to us all the time. And kind of the way I look at it, I remember when we were first in med school, whether you have a flu or you have kuru, which is a cannibal disease, the symptoms may be similar, right? Type deals.
Sure.
So what happens is that whether it's a very odd thing or if it's a very probable thing, when you don't know what you're doing, it all kind of can see like it's all in that differential diagnosis, and that's where yeah, you can do your chat GPT research, you can do your other AI, your Gemini or whatever, but at the end of the day, you're still going to want to come and talk to a practitioner that has experience and that has spent time studying this and being able to kind of sift through some of the BS out there. So you have a
Right,
patient.
but
Yeah.
I would also say humility, because
Yes.
guess what? Despite what I know and you know, I would say that we still there's still fundamental concepts and biochemistry and other things like that that we don't know. Just the other week, another organelle was just discovered.
Mm.
So I think realistically, we don't know what we don't know yet.
Oh, thank you. And I hope all the practitioners, the ones that are practitioners are listening, just hear that again. It's under having that, being able to say we don't know, and not having that quick response, which I've seen a lot of conventionally trained practitioners do, where they just say there's nothing to that when they really don't know what they're talking about. Like they don't, is there really nothing to that? Did you study it? Have you looked into it? Did you look at the research? Don't dismiss your patients. Like or that whole it's my way or the highway type of attitude. I think that's one thing similar. You and I both don't do that.
True.
You have a patient in front of you that is maybe they have a family history of Alzheimer's disease, they're having some memory issues, and they're sitting in front of you, and now it's time for you to do that evaluation. What's your initial evaluation look like?
Yeah. So first, it's getting a really good history, and I learned this in medical school. It's still true. The first thing I do is get a good history. Were you breastfed? Were you, what toxins were you exposed to? What infections were you exposed to? What countries have you traveled to? What other doctors have you seen so far? Have you seen anyone else for this condition? And what's worked and what hasn't worked? And then if we're talking about memory loss, what has been kind of the course of it? Has it happened all of a sudden? Were there head traumas? I mean, I'm going deep, and often it's a breath of fresh air, because the patients are used to, unfortunately, cursory histories these days. And so I'm going deep because I find often a lot of the information is in there.
If you had limited time, so you obviously have the luxury of having time to go over that history, and I think that's one of the challenges is not everybody watching this will have the time to do those in-depth histories, and they might have to break it in small visits. Would you say, the key 3 to 5 historical pieces that you've seen make like the biggest difference?
Sure. So if we're talking about Alzheimer's or dementia, you want to
Hmm.
find out about head trauma. You want to find out about sleep history, because poor sleep is the number one risk factor. You want to find out about toxins, infections, and oral health. I mean, if I had to just pick up five quickly, yeah, sure.
Those are some big ones.
Yeah.
Nice. Okay. So now history. How else? What about evaluation? What other evaluations would you do?
So again, I would see what they've already had done, because
Okay.
I'm not for repeating. If they just had an MRI done last week, I'm not repeating that. I want to know the results of
Okay.
it. So I
No,
want to
I'll tell
see.
you what they had done. So this person, yeah, my doctor got a CBC and said a CMP and said I was fine.
Okay, so first thing is I'd actually want to see those results,
Okay.
because, so as an example, looking at the CBC, the differential, they may have a ton of eosinophils, which goes along with either parasites and or allergies, and I'd want to know about each of those. But
Okay.
on top of that, other testing I'm going to do, I am going to be looking at, well, I'd want a urinalysis. I would want I would want a full toxin panel looking for heavy metals and industrial toxins like BPA, forever chemicals, and
So heavy
mold.
metals,
Yeah,
are you getting heavy metals? Because like Quest and LabCorp, you can get heavy metal panels. Do you get those at all, or
yeah, I can. I'll often use a company like Vibrant, a
okay,
functional test, but there are other companies too I like. And and for heavy metals, I like looking at both blood and urine.
okay,
I find both of those helpful. For the industrial toxins, again, I like Vibrant, but there are other
okay?
companies that will do it. Same thing for forever chemicals. I think Quest and LabCorp may have that available, but I like looking at it at a more functional company.
So for Vibrant, is there a particular panel that you do with Vibrant Labs?
Sure, I get what's called the total tox panel, which
Okay.
includes the mycotoxin or mold toxin, the heavy metals, and glyphosate, and the industrial toxins.
Okay, so then it's going to check all of them in that one.
Correct. And then I normally add the forever chemicals because I find them important.
Okay, so the forever chemicals are add-ons. Can you
Yeah.
explain to the audience what a forever chemical is?
Sure, sure. So it goes back to a while, um, back to wartime, World War II, when these chemicals were developed. Basically, it's a carbon linked to a fluoride, and very strong chemicals that were applied by the military. And then after World War II was over, they were like, "What can we use this for?" Oh, we'll use it for Teflon pans, and then we can also use it for, you know. Anti water on clothes, and we can use it on dental floss, all these personal care products. The problem with all this is we now know that these forever chemicals cause cancer, they're endocrine disruptors. They're not good, and you don't want them in your body. They're in the drinking water, they're in the food supply, and that's why I normally check them because that's also something, if it's elevated, I want to lower it for someone who's having symptoms.
So, like, we know that for those of you going back to chemistry, we have the periodic table. In the periodic table, you have the halides like chloride, fluoride, bromide, right? Iodide or iodine. So you have, and they look very similar, and that's where our body takes up iodine, and tissues that are more rapidly proliferating, they're going to need more amounts of iodine. So then you have, if the environment has a lot of chloride, bromide, whatnot of those halides, then it can kind of overwhelm the system and decrease iodine uptake. You're saying forever chemicals are molecules that have like fluoride attached to them?
They do. And
Okay.
it turns out the carbon fluoride bond is an extremely hard bond that normally our ancestors weren't exposed to. So
Okay.
once these molecules make it into our body, they're fatty, the fatty tissues. They end up lodged in our brain and other fatty tissues, and it's extremely hard. Number one, for our body to push it out of the fatty tissues and get rid of it. Number two, it's very hard for the body to manipulate it and help metabolize and get rid of these chemicals. So once they get inside of us, it's very hard for our body to get rid of them without some external help from us.
Now, when you do this toxic panel and you're seeing you're looking at levels, I take it.
Yeah.
Is that something that you can watch the patient's levels go down eventually?
100%.
You can
If
recheck it.
they if they have high levels, we'll do specific detoxification protocols, and we'll watch the levels go down, or hopefully go down. If they don't, or if they go up, then we'll come up with some plans like why are they going up or not going down, and then we'll try other things. So I find it useful, number one, to help the patient and their families understand what's going on, and then also to monitor the success of our treatment.
What other tests are you doing?
Sure. So I also like to measure autoimmune autoimmune disease in the brain and the nervous system to see if my patient's immune system is attacking, for example, their dopamine receptors or other other neurotransmitter receptors in the brain.
Is
So
that a panel? Is that a particular panel you're doing?
that's the panel. The one I like is from Vibrant. It's called the NeuroZoomer Plus.
Okay. So you check a neurozoomer.
Correct. And
Okay.
it'll tell me if there's active brain damage, if there's active destruction of their brain and nervous tissue, nervous
Okay.
system tissue.
Because the destruction leads to the body attacking it, the antibodies.
100%. And if there's active if there's active destruction, especially like IgM, I know that within the last couple months that this is not a historical issue. This is something that's going on right now, and we better stop this if we want to stop the progressive worsening of the patient.
Yeah, interesting. 'Cause if you read about, so one of the common autoimmune conditions, probably the most common, is Hashimoto's, where the body's attacking the thyroid, and people see those antibodies and think, oh, the body's attacking the thyroid, which is true, but the reality is that the thyroid is being destroyed and it's leaking into the blood tissue, and then the body's making those antibodies. And you're kind of mentioning that same process happening in the brain. So you do this antibody panel, right? What else are you looking at?
So I'm also I like getting something called the Tick-Borne 2.0. So I'm testing for Lyme disease and Bartonella and parasites like Babesia and viruses like herpes simplex virus and CMV and Epstein-Barr virus. So I'm basically doing an infection panel to get a sense of what's going on there.
Okay. What else are you checking?
Okay, so then, well, with all these, I'm also it's a two-way street because
Yeah.
there's some people who are like, I don't want to test for anything, and then there's some people who say, hey, I'm worried about Alzheimer's. I heard there's a new blood test for Alzheimer's. Can I get that? And
Okay.
looking at p-tau 217 or some of the amyloid. So for patients who are interested, we'll get that. I'm also doing a genetic testing. I'm
Okay.
I'm I'm looking,
Well, let's go
especially.
back. So that the tests that you were talking about, more specific for Alzheimer's, those are in Quest, right? You could get it with a regular lab.
Um, you can now. That's true.
Yeah. Yeah, yeah. Okay. All right. So tell me about your key genetic tests that you're looking at.
Yeah, so I'm normally looking at a panel of a couple hundred different SNPs that are
Okay.
relevant specifically to the brain. It's not just ApoE, looking for ApoE4. That's important, but there are literally several hundred other ones that I'm looking at. And what's interesting is that it turns out that the genetic mutations that are rare, if you have two copies of a rare genetic condition, often those are the most important SNPs. So if you're not if you're just looking at one, often you're missing out on some of the important information that's out there.
Okay. Now, is there a particular panel you're looking at with a particular lab?
Sure, I'm normally looking at the Intellex DNA, their cognitive panel.
Okay. So telex DNA, and insurance doesn't cover this, right?
No, and that's the challenge is insurance often will not cover most of these functional tests.
Can you give me an example of how maybe something on this Intellex DNA panel, something that you can make a significant, that you see abnormal, which creates a change in lifestyle or in supplementation or whatnot?
Oh, 100%. So someone might have a rare genetic disorder that gives them a very low level of magnesium in the brain. They may have a defect where it's hard for magnesium to be transported to their brain. So even though they might have a good high level of magnesium in their blood, they will have a low level of magnesium in the brain. And of course, it's normally hard to measure someone's, blood magnesium level. So if I see they have this rare mutation, I'm going to be pushing a lot more magnesium because I know that they need extra.
Hard to measure the brain magnesium, right?
Exactly.
Yeah, yeah,
Yes.
yeah. So I don't think people want us doing brain biopsies too often.
No, no,
Yeah.
not good.
So you'll
Or even putting a needle in their back and doing lumbar puncture, that's normally not fun and can cause
uh,
headaches and other problems.
okay. So now let's talk about the imaging studies you'll get.
Sure. So, and again, sometimes patients will come in with something he already have had something, but sometimes I'll get patients who have had dementia and have had zero imaging tests. So to my
Mm,
mind, the very first thing is I need either a CAT scan of the brain or MRI of the brain to make sure we're not looking at a structural problem, a stroke or a tumor or something like that, just to make sure they don't have that. So again, that's where having previous records, previous imaging is important. Um,
right.
the next thing I like to get, although sometimes it's difficult, is a PET scan of the brain with neuroquant imaging, so I can actually look at the amount of activity in different parts of the brain at a very good detail, and then the neuroquant gives me actual numbers where I can compare how this person's brain is compared to what an average should be for someone this age.
Now this is a PET CAT scan?
Correct.
A PET CAT scan. Okay.
Correct. Um, I al I also sometimes will get an amyloid PET looking for amyloid deposition in the brain. That's one historically been one way we can diagnose Alzheimer's, for example.
Okay. And
And
any other, are you doing SPECT scans or any other type of brain scans?
yeah, so to my mind, SPEC scans are really old school. I mean, they were cool 20 years ago.
Mm,
I mean, if someone had them, yes, I want to see them. But to
yeah.
me, they're almost like comparing tomography to a CAT scan. They're
Mm.
interesting, but they're kind of blurry, and I want the real detail which you can get with a PET scan.
And you're
So
seeing, and just for the audience, like you're seeing the actual patterns that are going to be indicative of, hey, this Alzheimer's process is actually happening, right?
100%, but
Because,
correct. But just
right.
to be clear, Alzheimer's is caused normally between 30 and 200 root causes. They're not all the
Mm.
same. And that's why I like to actually look at the imaging myself, because it can help me figure out, well, which parts of the brain are involved and how bad are they, as opposed to just looking for, is there amyloid or tau or, whatever specific protein might be focused on.
So amyloid and tau, can you, so those are, you'll see that with the PET scan?
If it's a
Mm.
specific imaging sequences
Looking
were done
for
to
the amyloid,
right,
yes.
right. If the plan was to do that, yes, you can.
So, so what is the typical pattern that you see with Alzheimer's with like with a PET scan? Which areas of the brain are usually are because you're looking at these on your own, right?
True, true.
What are the common patterns that you're seeing?
So one thing I'm commonly seeing is the frontal lobe, especially the lateral parts of the frontal lobe,
Okay.
because that's where 4-second memory is.
Mm,
The people's short-term memory. And then I'm also seeing involvement of the medial temporal lobe,
okay.
where memory, where you get 4-day memory, where memory gets consolidated. So those are two key areas I'm looking at. But I'm looking everywhere. Often I'll see um, defects in the occipital lobe, and I'll check
Which
to
is
see if that
visual, right?
the visual to see if they're visual deficits. But again, I'll also see what's really cool on the PET scan with neuroquant. You can actually see on the surface of the brain previous head trauma.
Mm,
And then I also like to look at the cranial nerves, the 12 cranial nerves. Sometimes you can see specific patterns where there's infection or trauma or toxins involving different cranial nerves. And then I can correlate that with specific symptoms. So, for example, a cranial nerve 9, if someone has a hoarse voice, has trouble talking, that's often due to infection, for example, with the Lyme spirochete of cranial nerve number 9.
Yeah, it's interesting. I remember reading actually years ago that the commonly the abnormality, the area of the brain that's affected is very similar, if not the same areas that are affected when you have herpes simplex virus of the brain. And that's why one of the theories is that, at least for some people, they actually, instead of herpes virus causing cold sores, they're having these attacks where the herpes virus attacks these different parts of the brain. Is that
A
your
100%.
understanding?
It is, but it's just to be clear, it's not just the viruses. Bacteria do the same thing. Parasites do the same thing. And you
To
know
the
what?
same area of the brain?
They can,
Mm,
and they basically just want to survive, and they're
okay.
looking for parts of the brain or the body that are relatively protected from the immune system.
Okay.
So
So those are very key areas that you can hide in. It's kind of like shelter for the bacteria or viruses, and
true.
they go hang out there.
True, and you see certain patterns. So, for example, um, toxoplasmosis uh, parasite, you'll see more in the temporal lobes. And after seeing thousands of these, you develop a pattern like, oh, I see, oh, or COVID. Oh, I see it in the cranial nerve one distribution. I see it in the medial frontal lobe because it's actually traveled back from the nose, or the mold can also do that too. So you develop a sense of pattern, seeing many of these different cases.
You're you're looking at infection, you're looking at toxicity, you might be doing a gut panel, you're looking at genetic predispositions, and you're looking for these patterns, you're looking doing a deep history.
I'm also looking, for example, quantitative EEG is
Okay.
another way to measure function. And we haven't even mentioned, I'll also get a CNS vital signs or some type of cognitive test that's
Okay.
objective, where I can actually measure in less than an hour, what parts of the brain seem to be working and not. Is processing speed good? Is memory good? Is, all those different things.
So can you explain the quantitative EEG to a health coach? And then the same with CNS vitals.
I can try. So what the quantitative EEG does is it measures electrical activity of different parts of the brain. And the Q, or the quantitative part, actually gives you a number, and then those numbers can be used to create a nice colorful display showing you what parts of the brain seem to be working well and what parts are not. And again, the important one of the important parts of all these tests is so we can measure progress or lack of progress, or worsening, because that way we have something objective as opposed to asking a patient or their family, how are they doing? And what's interesting is often, unless they're back 100%, they're like, oh no, they're not doing good at all, because they're like, you know, if they say everything is good, it's like, oh, okay, we're done, enjoy life. So that specifically is the quantitative EEG. With CNS vital signs, you're basically looking at a screen, and you might be given, for example, 15 words to remember, or 15 shapes to remember. And then right after you're shown these, you're asked to, you're shown a word or a shape and say, hey, is that on the original 15? And then at the end of the exam, maybe 30 minutes or 40 minutes later, those same shapes or words are repeated. And to see, were you able to convert this from 4-second memory to 4-minute, or even to 40-minute type memory? And then there's also processing speed. If you ever see the letter E, I want you to press the space bar, and that gives us an idea, not just if you're doing it correctly or not, but how quickly you're doing it.
Nice. And I really like CNS vitals because it's all it is you're doing this computerized test, but it's giving us this data that other we'd probably have to send people for a couple days of neuropsychiatric testing to get similar results. So, and then what's nice is tracking and then giving I think a lot of people will say, okay, I'll just do puzzles and it'll help with memory, right? But it depends on what type of memory is off, right? What
100%.
Right, right. Awesome. Okay, so now we did the big evaluation, and now we have more data on this person than we even know what to do with, right? And now it's time to start management. How do you manage them?
Right. So, well, first you look at all the results and you go over them with the patient and their family.
Okay.
And and
Explain
then
the process, the biochemistry, right?
100%. And then normally I've got a dozen different places where I could go.
Hmm.
And I normally don't want to overwhelm someone and say, "Hey, we're going to do these 20 different treatments." I'll normally come with the approach of, hey, you've got high levels of toxins. Let's look at that first. Or, hey, well, why don't we make sure I'm worried about your sleep? Why don't we send you for a sleep study, as an example?
Okay, so you pick one or two things to start working on. And then you have
100%.
yourself, you have a plan. You have like maybe 15 or 20 imbalances that you're thinking about. How do you keep track of that?
Yeah, so we use an electronic medical system. Um, um, and and that's basically how we're keeping track.
Our management team, and it extends it extends to functional medicine patients as well. But our management team here at the office, we're going through um, we're going through execution. Like, how do you improve execution, right? You have so many things that you got to do, and it's hard to get things done when you're going through what's called we're looking at the books, the four disciplines of execution, and it's like they call it the whirlwind. The day-to-day stuff stops us from progressing further, right? We're just surviving, putting out fires. And there's a principle, and that principle is that complexity is the enemy of execution. And you and I talked about it, I think, a little bit on the pod. You interviewed me on your podcast,
That's
and
right.
the metabolic approach to Alzheimer's. So I like that you're saying that. Can maybe if you can tell me some common abnormalities and treatments based on if that's the primary. Like, okay, if they have traumatic brain injury, then what? If they have, maybe you can go through some of those.
Sure. Sure. Let's start with traumatic brain injury. I like a few things for it. I like exosomes, which are normally they're basically stem cells without the cells, or a collection of over 500 different growth factors. I like cerebrolysin, which is another peptide. But normally, before doing those, I will focus on detoxification first,
Okay.
because I find that these peptides don't work as well unless and until you've pushed a lot of the toxins out of the brain first.
So what's happening if they have traumatic brain injury? What's happening? Why is the brain not the injury's over? Is it a scar? Is it hibernated brain tissue? What's happening?
So it's a scar, and again, on if you get a PET scan of the brain with neuroquant imaging, you can actually see decreased activity in localized parts of where the trauma was, whether it's the coup or the contra coup type injury. You can actually see on the surface of the brain, because the brain is obviously a soft tissue, and during trauma, it hits against the hard bone. And you know, initially there's bruising. Hopefully that resolves, but in many of these cases it doesn't, and you see long lasting
Changes.
poor changes, often on the surface of the brain.
Yeah, one of the theories. So we do hyperbarics in the office, and I know you do hyperbaric oxygen therapy. And one
Right.
of the theories is that the brain with the traumatic brain injury, the brain feels like it's compromised. There's a decreased blood flow. So in order to save itself, it goes into hibernation mode where it just doesn't die, but it just kind of turns off. And hyperbaric gives you that oxygen under pressure. Now you get this extra oxygen to the brain, and the brain's like, okay, it's okay, I can wake up now. Is that your understanding of it?
Yes, totally. That's a great description. And I also will use hydrogen gas too, inhaled hydrogen too.
And what's the inhaled hydrogen do?
Yeah, that actually improves the mitochondrial function of cells in the brain, with the same goal, to try to resurrect tissue that may be stunned or hibernating.
Okay, so if they have traumatic brain injury, you work on removing toxins. I take it through supplements. Do you give them medication sometimes?
I do.
So supplements and you get rid of the toxins. And then you do things like hyperbaric, you said exosomes. Is that a IV or is that injected into the cerebral spinal fluid or how do you do the exosomes?
Yeah, I'm normally doing it intravenously.
In the vein. So you
Yes.
inject it into the vein. And then we mentioned hyperbaric, right? Is there anything else that you tend to do for traumatic brain injury?
Yeah. So I also like um, for everyone with brain dysfunction, but including with head trauma, I do like certain essential oils like Spanish sage and rosemary essential oil, and I'll get patients to take a couple drops under their tongue. I also like lion's mane. So yeah, I like both of those.
Okay, yeah. So now that you have this patient who's like, look, bud, I'm not going to do any of these expensive therapies. I have an Amazon account and I'm on an island. But they can ship me anything. What would you tell that person that had traumatic brain injury sitting on the island and the
You mean like
Amazon account? What would you tell them
oh,
to do?
you mean like an island like Manhattan or another type of
Yeah,
island?
no, I was thinking Caribbean island. Like
Caribbean island. Okay.
Manhattan,
Wow.
you'd probably go do hyperbaric and exosomes.
Exactly. Yeah, but yeah, if they're in a remote area, it's
Yeah,
definitely challenging, right? Because
yeah.
I can get them essential oils. It might be more I can probably get them a machine to generate hydrogen, but it's going to be difficult to get them exosomes or
Right.
cerebrolysin or things like that.
But exercise is big, right?
Oh, 100%. So
I mean,
lifestyle. So you
yeah,
do
yeah,
exercise,
yeah,
you work on their diet, you decrease the amount of their processed foods,
yeah, yeah.
you decrease their stress, and you make sure they're getting enough deep N3 sleep because that's during deep N3 sleep, that's when the brain is able to consolidate memories and get rid of the amyloid plaque.
Yeah. Do you tell them to sleep on their side?
I do. I say normally on the right side is going to be the best.
Yeah, because of that glymphatic system, the glymphatic flow. Yeah, we I'll give them like nitric oxide boosters too to help with the flow as well. All right, so traumatic brain injury.
I'm the same way. And I'll start with though, eat your leafy greens. Yeah.
Yeah, yeah, yeah. So traumatic brain injury, we talked about. We kind of talked about toxicity. Maybe what have we not
Right.
said about dealing with
Right.
toxins?
But actually let's focus on this a second because what I find is many people, even if they don't remember it, have had traumatic brain trauma at some point in their life. And that's the fascinating thing looking at PET scan is I can say, hey, on the vertex of your head, there's an area there that's probably from head trauma, but I don't know if this is from a car crash you're in 6 months ago, or maybe when you're 2 years old, your mom dropped you on your head. So I would say having looked at lots of brains, most people have some type of head trauma. That's
Mm,
just the reality that I've seen.
okay. No, thank you for mentioning that. I think it's yeah, they have the head trauma and then they don't even think about it and they keep moving forward. And then of course, if you're a football player, if you like headbutting people, then that probably you probably have more of a chance of head trauma being the main thing.
Oh,
Um,
100%. And then when I look at their PET scans with NeuroQuant, they might have, a dozen different areas on the surface of the brain where there's poor activity from, getting sacked so many times.
so toxins, what have we not mentioned about dealing with toxic overload?
Wow. Well, we haven't really talked about how to treat them. Um, and just in terms of treatments, there there are simple things to do or like glutathione by mouth spray or topical or both. And
Hmm.
then more effective will be intravenous glutathione. So I'll normally start with glutathione for detoxification. And if someone has high levels of toxins, I'll often go to something called total plasma exchange, where we'll take blood out of one arm, get rid of it, and then in the other arm put back albumin protein to balance out the fluid side. But but that's the frustrating thing. When I first learned about some of these fatty toxins like DDT, PCB, I was told that in humans, there are only two ways to get rid of these fatty toxins that have a half-life of 20, 30 years. One is to breastfeed if you happen to be a female, and also if you happen to be a female to have a baby, many of these fatty toxins get passed on to the next generation, which I know
Mm.
sounds horrible. But the good news is, unlike the dark ages of 20, 30 years ago, we actually have technologies now where we can get this out. And one of those is the total plasma exchange, where we actually remove the blood that has these toxins in it.
And that's the plasma, is if you spin the blood, it's the water part of the blood.
Exactly right.
Yeah. You know what's interesting? Dr. Salt, we interviewed him. Not we, I did, but there's people helping me with the show. But Dr. Tom Salt, we talked about Lyme disease, and what he was mentioning is he likes the ketogenic diet for that purpose, because if you're trying to flush out fat soluble toxins, he was saying, then what you want to do is you give more fat so it gets that fat moving. Do you
Correct. And
do?
yes, I'm a big fan of ketogenic diet. I'm also a fan of fasting because
Mm.
guess what? After doing 3 or 4 days of water fasting, you're going to be producing lots of ketones, and your body is going to start using the visceral fat preferentially for calories because it's the most metabolically active. So yeah,
So
so
back to
yeah.
the guy on the island, decrease the toxins you're putting in, right? Eat more organic foods, which hopefully he's growing them. Keep exercising, drinking water to flush it out. Maybe a ketogenic food plan. If a so if I know it's not this fully the same, but some people will donate plasma, and that gets rid of some of their plasma. So maybe doing like a million of those.
Yeah, so I'm a big fan of donating blood and plasma.
Yeah,
But to go back to your last point,
yeah.
it turns out the Lyme spirochete likes to hide in different parts of the brain of the body, including the brain, in biofilm, this biologic film.
Mm.
And so another thing we use is intravenous phosphatidylcholine to push these fatty toxins out of the brain and other fatty tissue.
How about oral phosphatidylcholine? Do you feel like
Yeah,
that's helpful?
yeah, I have. The challenging thing is by the time I'm seeing people, they may have already been through
The
oral
oral
phosphatidylcholine.
piece.
Yeah, I'm not a big fan of oral choline or phosphatidylcholine because it tends to lead to increased production by your gut microbiome, by the bugs in your gut, of something called TMAO,
Mm.
which is a pro-inflammatory compound. And we now know that one of the big risk factors for Alzheimer's is inflammation. So the last thing I want to do is give someone a supplement that's going to increase inflammation.
Yeah, we use phosphatidylcholine a lot for fatty liver because there's some good data on oral phosphatidylcholine for fatty liver. But yeah, the choline, carnitine, those things can if they have the wrong certain bacteria in the gut, they can increase TMAO, and that is something that you can check. It's a marker to see if it's turning it into TMAO or not. But you're saying people will go on that phosphatidylcholine. Usually they already tried oral. Now you're going right into the system, and you're
I,
um,
I am. And what I'm also saying is many, not all, many of my patients happen to have mold or mycotoxins in their gut,
mm,
preventing absorption of both food and supplements I'm giving them. So I
mhm.
know if I'm giving them these things intravenously,
Yeah,
they're gonna get to the brain and they're gonna work. But if
yeah.
it's oral, I don't know.
Yeah, yeah, yeah. And I think that's what for our audience, I mean, there's steps, right? There's you 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 don't have to be super aggressive in the beginning, but there are different steps and different levels, and you obviously take it to a higher level. You're doing higher level treatments. Yeah, if I do something intravenous is going to get higher levels of glutathione than if I'm going to take the different oral forms of glutathione. Absolutely. So I
100%.
think for
And often I'll give patients that option. I'll say, hey, if
yeah.
this was me or my family member, I'd go all in and we would be doing daily IVs and being aggressive. But there's some people like, oh no, I don't want that. I want I want the once a month treatment. And you know what? We have things that do work that way, but it's also, seeing what patients are willing to do.
So we talked about dealing with traumatic brain injury. We talked a little bit about what we do with toxins. You decrease the toxins going in. There's actually food plans. We have something called the 28-day cleanse. Do you have something similar where they're taking shakes that maybe help the liver get rid of toxins and chemicals?
100%. And then, just education about the water, their drinking water, the water they bathe or shower with, to prevent um, new toxins coming in. I
Right.
definitely push for lots of plants just because plants are lower on the food chain and have much fewer toxins if you're eating from the top of the food chain.
So what else, what other major imbalance leads to memory issues and kind of like an Alzheimer's picture? There's the infection piece, right?
Infection, definitely.
Yeah.
But I mean, there's so many. So another one would be hormonal imbalance. So, for
Okay.
example, yeah,
So let's talk about the infection, a
sure.
bit about what
Yeah,
we need to know about the infection piece, and then I think the hormone imbalance, and then I think that's a good that's a lot of information for people to look over again and again. So,
definitely. Yeah. So when it comes to infections, the challenge is there's so many different ones. And we're talking very small from the size of viruses, whether it's CMV or herpes viruses, to bacteria, and some of these bacteria are hard to find. Like the Lyme spirochete will form L forms and basically get rid of the cell body, and sometimes go intracellular. They can be really hard for your body's immune system to try to get them. And then on an even larger level, you've got the parasites, which can be microscopic or they can be huge. And I think parasites are an area that the average American and frankly a lot of physicians don't understand, that they're much more common than people think. As an example, they did a study on the island of Manhattan, people who ate sushi more than once. I'm sorry, if you eat sushi once a week or more, the majority of those people had parasites.
wow.
So so that's so raw fish is one source. Another common source are insect bites, mosquito bites, tick bites. And so just to be clear, you don't have to be bitten or even see a tick to get Lyme disease and or some of these other infections. And the challenging thing is often I find patients don't just have the Lyme spirochete, they'll also have other Borrelia species, and they may have anaplasma and Bartonella. They'll have all these other infections that are frankly acting together in this biofilm, this biological film, that these infections will spin around themselves to protect the bugs from your immune system. And what's interesting is you can have layers upon layers upon layers of these different bugs within the biofilm. And what's fascinating is in each layer, not only do you have bugs, but you have different toxins, fatty toxins, whether it's the PCBs or the forever chemicals or the heavy metals. We have documentation that many parasites will actually concentrate heavy metals within themselves to use as a weapon against other bugs.
Mm.
So as an example, we can do a blood and urine test and show that you have zero heavy metals. But then once we give you an antibiotic to kill the parasites, an anti-parasite medication, you'll find that all of a sudden these patients will have high levels of heavy metals. And we didn't just give them, they were actually hidden within the biofilm. So that's one of the challenges is the initial testing. We talked about all this extensive initial testing. The challenge is you can do that initial testing for infections or toxins for that matter and come up with very little. But then if you repeat those tests after you've had a chance to bust the biofilm with IV glutathione, IV phosphatidylcholine, with IV antibiotics, after you have that chance and you retest, you can see that, wow, all of a sudden it went from 0 to very high levels of toxins and infections. And that's one of these nonlinear concepts that most physicians don't realize. Now, and we're not taught about it. Sure, we're taught biofilm in basic biochemistry, but then it's not applied. But clinically, this is a real thing that we all have biofilm, for example, in our mouth, which is hopefully why we brush our teeth several times a day. And many of the infections in the mouth can travel to the brain anatomically. They're not very far. An example would be P. gingivalis. So, needless to say, infection is very complicated, and it's not one and done. Hey, I had one test for Lyme disease. I don't have it, therefore I'm good. No, often it's hiding, and if you retest after you start treatment, you may find it.
Very, very interesting. So for those of you just to maybe that fell asleep during biochemistry class where they talked about the biofilm. So the biofilm, if anybody's got like homemade yogurt, it has that kind of the stringiness to it. That's the biofilm. That's the bacteria will kind of arrange themselves. And actually good bacteria do this too, though. They kind of arrange themselves in a way where they have this biofilm layer to kind of protect it against damage. But so Dr. Salt, when he talked about Lyme disease, he was more about strengthening the immune system because we are going to be exposed to all kinds of viruses and bacteria and parasites, and some immune systems just do better than others. How much do you work on healing the immune system or strengthening the immune system?
I do work on it, but I'm very careful for the following reason. So I find if I just strengthen someone's immune system like that, and they have high levels of biofilm, that actually they'll get worse. Because if I treat someone with biofilm and get their immune system working, their immune system is going to be like, hey, look at all this biofilm. We're going to go to town here. We're going to start destroying it. And they will. And what's going to happen is they're going to bust all this biofilm that may have been deposited over 10, 20, 30 years. And they're going to start busting it up all at once, releasing all these toxins and infections all at once. And you're actually going to have someone potentially who's going to get worse. And the last thing I want to do when I'm treating someone is for them to get worse, which is exactly the reason why I focus on detoxification first. Because if I'm lowering the toxin levels and at least there I've got a margin of safety if I start turning on their immune system. The other thing is I will slowly turn on their immune system, because if I do it too quickly, I don't know how to turn off their immune system if it starts revving up and you're getting autoimmune things and you're busting biofilm too quickly.
Well, what are you doing to help the immune system?
So several things. So for example, if someone has heavy metals that's suppressing their white blood count, if I get rid of those heavy metals with binders or with total plasma exchange, boom, all of a sudden they're going to have more white blood cells. That's number one. Number two, I will work on using suppressing what's called galectin-3, which is an inflammatory protein. It's a lectin that's way too high in Alzheimer's and other chronic conditions. So I'll use an antibody, an FDA approved for compassionate use antibody, to lower that galectin-3 part of the immune system. You can also use a binder like Pectisol to bind to galectin-3. Sometimes I'll use things like IL-2 or GCSF to rev up someone's immune system. But again, it's not the first thing I'm doing. The first thing I'm doing to create a margin of safety is to try to get rid of some of those toxins so that if the toxin level goes up, at least it's starting from a low level and not from a medium or high level.
So the galectin-3 antibody approach, that's been getting a lot of press lately, right? Can you tell us a little bit about that more?
Yeah, no, that's been really exciting because it is FDA approved for compassionate use. It's called the Expanded Access Program. And it's exciting because real world experience I've had I'm one of the investigators using this drug. Real world experience, I'm seeing improvement often after just one dose. It's given intravenously once a month for 6 months. I'm seeing improvement often after just one dose. And then the next piece is I'm not seeing, and we haven't seen any serious side effects. Over 400 patients have received it. zero serious side effects. So that's really exciting. And
Nice.
then,
And what's that called?
yeah, that's called TB006, or it's an anti-galectin-3 antibody.
Okay. Okay. And last but not least, hormones. What do you do with hormones?
Yeah, so hormones, I feel like you have to look at all of the hormones. So I guess I would go back to the beginning and say, yes, I'm making sure we're testing for hormones too.
Yeah.
So an obvious one is thyroid. I find often people will have low levels of thyroid, which I'll work on improving, increasing the levels of thyroid. Same thing with testosterone. If their testosterone levels are low, I'll often work on increasing them. But it's not just those two, it's also estradiol. I mean, we now know that estradiol is important for brain function. And if someone has a low E2 level, we'll work on increasing it. Again, a lot of these hormones are interrelated. So, I'm not making, 6 different changes all at once. You start slow and it's a puzzle and you try to put it all together.
Okay. So you're balancing their sex hormones or thyroid hormone. And we have different guests who came on the show and talked about all those different hormone imbalances. Well, Dr. Josh, thank you so much. This has been an excellent overview. But now it is time to spill those functional medicine organic beans. We're going to go over the thing
Okay.
that you can't hear from, or you can't get off ChatGPT or different AI. And this is the experience share. To unlock additional premium content, including the deeper dive in this clinical topic, leadership and speaking tips, charting and efficiency pearls, and business mastery as a functional medicine practitioner champion, be sure to check out our mastermind and other membership programs at www.fmpessentials.com. Hey everyone, we hope you're enjoying the FMP Essentials show so far. Pretty amazing, isn't it? Remember, if you're part of our mastermind, don't miss out on our exclusive bonus clinical content. That's where we take a deeper dive, look at personal experiences and real-world insights that you can't just get from a book or from looking on AI. It's where we really get into the nuances that make a difference in your practice, the experience of the guest of our show. Thank you for watching, and we hope you enjoy the rest of the show. Welcome back, everybody, to the FMP Essentials Show. We just went over some behind-the-scenes stuff for those people in the private membership. So for those of you that are in the private mastermind, you're going to see this. Otherwise, I invite you practitioners to take a look at our private mastermind. Dr. Josh, before we get into this segment of the show, I do want to mention a little bit about how we met. We met at A4M. Which was called anti-aging, but it's also personalized medicine over in Florida, in South Florida, in West Palm Beach. We were both speaking, and believe we were both speaking about Alzheimer's.
True. And you spoke right before me, and I was like,
Right.
let me reach out to you because, hey, we're on the same stage, and
Right,
let's
right.
get to know each other beforehand. Sure.
And I'll tell you, I met you, you came and you approached me and you met me, and we had connected on LinkedIn before that, but I could tell like you're one of those people that just genuinely wants to help people. That's what I can see, that's what I can feel, that you're happy, you're excited, you love what you do, and you just want to help people. Like I didn't get any type of like you wanted anything from me or anything, just the friendship. And I really do appreciate that. And what would be amazing is if you can, not everybody is going to be able to do or even afford a lot of the treatments that we mentioned, but some of them are. If you could give us a little bit of hope to people that have dementia or dementia runs in the family, could you maybe start this segment off with a little bit of hope for those people?
Definitely. So I've been in this space for over 7 years. There are now published articles, or Dean Ornish published one last year in 2024. So this is not just something theoretical that, yeah, maybe it's true. No, this is my real world experience, published, randomized control studies showing it. And frankly, that's why I reached out to you, Dr. E, because I truly do want to spread this information. And I view the both of us, we're on the same team trying to get this information out there to the general public and other physicians for that matter, that there is hope and we should be focused on sharing ideas on how to help our patients. So, yes, there's definitely hope.
Yeah, and when you interviewed me last week on your podcast, I had mentioned this case where there was a patient that I had that I looked at the imbalances and I had this treatment plan for him and had certain supplements I wanted him to do, and he really didn't do much of anything. But the one thing is we had our health coach call him frequently to make sure he went for his walks. And just by going on a walk every day, it completely shifted and his memory got better. So it's not like I don't want people to feel like, oh my God, I can't afford to go get plasma exchange or come here and do hyperbaric oxygen. They're just pieces, they're just tools, and we do what we can. That being said, a big piece of FMP Essentials and a big belief is giving back. We believe that functional medicine practitioners are like a fruit producing tree, and that fruit has seeds, and those seeds are planted to make the world a better place. That's our legacy. That's us making our imprint on the world, and you are definitely doing that.
Yeah.
I would like to ask you, what are you excited about right now in your life?
Yeah, so I'm excited on what we're talking about, reversing Alzheimer's. I see at conferences 70 to 100 new treatments in the pipeline. So I'm confident we're going to not only reverse this, but make it easier from year to year. So from a professional standpoint, I'm really excited there. I'm also excited from a personal standpoint, applying the lifestyle approaches to myself. I see that I've got more energy, more happiness than frankly I can remember ever having. And when I talk to family and friends who've known me for a while, they're like, "Hey, Josh, you are so happy." Like I am. It's infectious because I'm optimistic about the future of reversing Alzheimer's, but I'm also excited about the future of longevity and turning back our biologic clock, because when we turn back our biologic clock, many of these diseases, including Alzheimer's, that are dependent on aging, will also be prevented or turned back. So, and I'm also super excited by just technology in general. I see the potential of AI and then these other approaches really exciting. So yeah, I am so happy that some of this biochemistry stuff I learned when I was a teenager, I'm actually getting to apply it now, many, many decades later. So yes, I feel fulfilled that a lot of the hard work I've gone through is actually paying off now.
And what are some impactful ways that we can contribute to our communities?
Yeah, so the exciting thing is today, unlike hundreds of years ago, our community can be as we define it. It can be, sure, our geographical local place, but it can also be, people who are dealing with dementia. It could be that group too. So yeah, so I find it really exciting that technology allows us to find people who share similar interests to what we're doing, and then communication. I mean, this is like out of Star Trek, right? That you can just pick up a screen and do video calls with people. Well, that technology is here today. So things I grew up as a teenager dreaming about is here today, and yeah, it's really exciting.
What about like a larger scale, maybe donation scale? I like donating to the Environmental Work Group, the Institute for Functional Medicine. They're non-for-profits propagating the message of wellness. And is there any particular organizations that you like donating to for this cause, for the wellness cause?
Sure. So I'm biased, but with our Alzheimer's Treatment Centers of America, we have an Alzheimer's Treatment Foundation,
Hmm.
which I give to and I recommend because that allows us. I mean, some of our treatments are expensive. It allows us to offset some of the cost and make some of these treatments available to people who can't afford. And frankly, that's my vision, is that sure, right now a lot of these treatments are expensive because they're cutting edge investigational, but as they become more well known and more used, the prices are gonna drop. And yeah, so but I also like the EWG Environmental Working Group. I haven't given them money, but I do promote them. So yes.
Oh, they're watching. They're gonna call you. They'll be
Oh,
calling you.
okay.
Just give me your credit card information and
Okay. No worries.
no, what I like about them is they are doing I don't have any affiliation, but I just like the work that they're doing. They're bringing awareness of toxicities and even things to do about it to us, to the consumer, something that I feel like the government should be doing, but they're just not. Maybe
Right.
they don't have the funds or the staff or whatnot. I guess now maybe it'll change with AI.
I hope I'll also put in a plug for, I like the American College of Lifestyle Medicine. I'm board certified with them, and I like their message that they're spreading, which is that so many diseases and problems can be solved just fixing what you're eating, if you're not exercising, getting rid of smoking and alcohol and things like that.
Are they a non-for-profit?
They are, yes.
Okay, good. So that's another non-for-profit organization to donate to. For those of you listening at home, whether you are a functional medicine practitioner or a functional medicine enthusiast, we really appreciate that you tuned in here. We ask that if you have a friend or colleague that's interested in functional medicine or healthcare, to send the podcast their way. Also, if you have a family member that's interested in a career, I'd say why not take a look at a career in functional medicine? So send these episodes their way as well. Dr. Josh, you have been so generous with your time and expertise. You are doing some amazing things, very exciting. How do people stay connected with you?
Oh, wow. A couple of different ways. Probably the easiest way is just to go to my website, which is drjosh.com, drjosh.com. And my email address is drjosh, drjosh, at drjosh.com. You can also find me on social media under Green Brains MD. That's Green Brains MD. So those are the easy ways to find me.
Dr. Josh, thank you so much.
Awesome, Dr. E. This was amazing. I appreciate you. Peace and plants.
Hey everyone, I'm Dr. Yousef Elyaman. We hope you enjoyed the show. For more exclusive content from this interview, check out our FMP Essentials Mastermind. Make sure you check out our website at www.fmpessentials.com for our blog and other content. If you enjoyed this show, please subscribe. Give us a like. It helps way more than you could imagine. Thank you for watching. Follow us across all social media platforms at FMP Essentials HQ. Please don't forget to share this with your practitioner friends, and we'll see you in the next episode.